Today we're going to do a periodontal health screening. This is a laminate that we have come up with that describes progression from health to disease in the oral cavity. And so I'm going to use a little instrument that will be my evaluation tool. We call it a probe, but it's much like a ruler. It has tiny millimeter markings on it, and these numbers illustrate the height of our bone, or foundation of our teeth lion, our gingival health. So in health, you'll hear me call out 1, 2, 3 millimeter measurements. When I evaluate this tissue, you can see it's nice and toned to the teeth there, won't bleed on me and be sensitive. When we take a look at this X-ray, this lower gray line is actually our bone. And in health, we see it run straight across there, okay? When we get into gingivitis, or precursors to our periodontal diseases, we still have 1, 2, 3 millimeter measurements, but our tissue is a little bit deeper red of a color, little areas of inflammation, and it might bleed or be sensitive when we touch it. When I take a look at that bone, however, that lower gray line is still straight across. No bony changes have occurred in gingivitis. When we do start to see early signs of bone loss is early periodontitis. I'll get a 4 with my probe, so I'll reach a little farther into that tissue to meet the height of that bone. You can tell by our tissue here it's a little more puffy, a little more deep of a color, and it may bleed on us while evaluating. And when we take a look at that bone, we can see that there's tiny slant downs in this area. When we get to moderate perio, we'll have a 5 millimeter probe depth, so we'll drop down a millimeter more. You can tell by our tissue here it's a lot more puffy, and it will bleed on us or maybe be sensitive while evaluating. And when we take a look at this lower gray line, it's a lot easier to tell in the other picture, especially where this bone is dropped down on these back teeth. And when we take a look at advanced periodontitis, we'll get a 6 millimeter probe depth. You can tell by your tissue here, a lot of places for plaque to get trapped, a lot of puffiness, a lot of irritated tissue, and it'll probably bleed when we evaluate it. But most importantly, when we take a look at that lower gray line, this tooth, for example, we can see how that's dropped down about 50% down that root. If you can imagine, there's no anchor holding that tooth in. So sometimes at advanced periodontitis, we will find teeth are wiggly or we lose teeth from gum disease. We'll also, I don't expect you to be an expert. We went over this for a few seconds, but some things I do want you to pay attention to. Any areas of bleeding, any 4s, 5s, or 6s that we hear. And I'll also take a look at our gum line. These will be positive and negative numbers. Our recession, where we brush that gum away, looks a little bit like this. That'll be a positive, where the gum comes up. And a negative will be where the gum pulls a little bit away from the tissue. But do you have any questions for me so far in regards to anything?
No, great explanation.
Thank you.